Welcome to Parent Squad. I'm Felicia Lawrence. February is American Heart Month, and we often think about that as adults, an adults only kind of thing. But true heart health starts early. So we brought in a great panel of experts to talk about how to make it a family affair. I'm actually joined by Dr. Benjamin Helm. He's a genetic counselor with a PhD in epidemiology at IU Health. Dr. Laura Shop, who's a pediatric cardiologist at Riley Children's Health, and Dr. Julie Clary, who is a cardiologist at IU Health. Thank you all so much for being here. I feel like we are ready to go. With all of this med school up here, we got the people that know what they're talking about. So let's actually start with Dr. Helm. What role does family history play in heart health?
Yeah, it's a great question. So I really consider family history to be the first and often easiest tool that we can integrate to understand risk of heart disease or just get a snapshot of heart health in general. And the reason for that is actually because family history is really considered one of the strongest indicators of heart health because it captures both genetic and non-genetic contributors or causes of heart disease. And I should clarify really that when we're talking about heart disease in a general sense, like we are here, that includes really both genetic and environmental causes. But for most heart diseases, actually the majority of it is environmental, right? These are often lifestyle risk factors that contribute to heart disease. With that in mind though, that's why family history is often so important and so impactful, because when you do a comprehensive review of the family history, it captures both the potential inherited genetic risks or causes of heart disease, but it also to some degree captures those shared environments, shared lifestyles, and shared kind of cultural characteristics that are also part of influencing our own risk of heart disease. So with that, it's a very simplistic but also efficient tool to understand both the genetic and non-genetic. And I really consider it absolutely essential for any comprehensive evaluation of heart health or if there's questions or concerns for risk of heart disease. And really with those things in mind, I tell a lot of patients this, that family history and really genetics in general, we use it as a guide. It's a starting point, but it's a guide, it's not destiny, right? There are lots of things that influence our heart health, not purely genetics, but it's often a good place to start. And if anything, I just try to reinforce that with families that even if you do have a genetic risk, it doesn't mean that's your path or trajectory for life. And if anything, the opposite is true, where we actually can identify these risk factors that are both genetic and environmental and intervene very early on and alter trajectory so that we can prevent disease or be more proactive about preventing maybe some more adverse outcomes of heart disease. So altogether, it's really important to have that.
Yeah. Just having that extra piece of information can really make all the difference. I felt myself doubling down having an almost 2-year-old now when he was a baby being born and we were going to all of our OB appointments. That was a time to double down and ask aunts, uncles, of course your parents, you know, if you can. I never met my grandparents, so to know, well, what did they pass from? What did happen there? How important those questions are. So as a genetic counselor, what can you do to help families assess their risk?
Yeah, there's several things that genetic counselors will often do. And really it comes down to answering that question of, you know, what is the likelihood of an underlying genetic cause of heart disease? And really there's kind of 4 areas. The first is actually assessing somebody's personal medical history. And generally, we'll have a pretty good sense of really understanding the heart disease that's currently happening in somebody, or maybe their close relatives. And based on the type of heart disease or other characteristics about it, that can be a first indicator of the possibility of something being genetic. Again, the vast majority of heart disease in a general sense is not necessarily genetic, but that can be the first foray into understanding the possibility of something genetic. So that is an easy kind of first pass, and we'll often do medical records review results of imaging studies, review notes from other physicians who take care of patients. But then we really zoom out and more holistically, when we can, collect that family history. And genetic counselors will often do, just because we have the time and bandwidth usually, to do a more in-depth family history review. It can last anywhere from 10 minutes to maybe 30 minutes, depending, where we'll have targeted questions or more general questions about different illnesses or conditions in the family. But it's really that family history that's essential. And a lot of times we'll try to get as much as we can, and I often prefer to go back at least 3 or 4 generations. So it's back to somebody's grandparents or great-grandparents.
See, that I never met. So it's like I have to ask that generation what's going on so I can at least have enough knowledge for my son.
Exactly, yeah. So if we can go back that far, if we have the opportunity to, and we don't in all cases, and that's okay, but we kind of go back far enough and we'll start to look for patterns in the family. So maybe clusters of like similar types of heart diseases or the exact same type of heart disease. Or in some cases, maybe clusters of people who have maybe similar features or similar symptoms of heart disease. But that can also be combined with that personal history and give us an overall assessment. And And really combining those first two levels leads to the third level, which is the consideration of diagnostic genetic testing. So again, not all heart disease is genetic, but that genetic testing can be really essential to help us really confirm an underlying genetic disorder or genetic risk factor that can be causing heart disease in a family. And so a genetic counselor can take all that information, help educate patients and families, help contextualize it, integrate that information into their own understanding for themselves. And that really is the last level, which is oftentimes my work as a genetic counselor is serving as a bridge. And what I mean by that is I'm often a bridge within families. So once we identify these familial risks, I start enhancing or facilitating communication within the family about letting people know that they might be at risk, that they should be screened for something, that they could do genetic testing to confirm or rule out if they've inherited the risk for it. And so a lot of times I kind of joke that the patient is my patient, but most of the time when I deal with familial diseases, the family becomes the patient.
Yes.
And I get to have the opportunity to really serve as a resource to entire families. And kind of riding from that, that bridge analogy really is a bridge to other clinicians. So a lot of times I work collaboratively in a multidisciplinary way to identify these genetic risk factors, identify the family members who are at risk, and get them to the appropriate people who can take care of them. Because at the end of the day, I can do my job at identifying genetic risks, but I need to rely on my colleagues to actually do the medical management,
yes,
to reduce this
absolutely.
risk and prevent disease. And it provides awesome opportunities to do that comprehensive kind of family-based care to take care of people.
Family-based care is certainly what we need. Again, Dr. Shop is here, and she is a pediatric cardiologist. And when you think of heart health, you don't usually think of children, and you don't usually think of symptoms like high blood pressure, but you're saying that this is a growing trend that you're seeing in your practice?
Certainly, yeah. There's a rise in all cardiovascular risk factors in children these days: high cholesterol, high blood pressure, obesity.
Wow.
Just to start, but there was a recent international study that showed that the rates of pediatric hypertension have doubled in the past 30 years. So certainly a significant increase.
High blood pressure.
Yep.
Where is that? What would you say are some of the things that is stemming from that?
So,
or a cause of that?
Yeah, so high blood pressure, so hypertension is just when somebody has high blood pressure for long periods of time. And everybody's blood pressure is supposed to go up and down throughout the day. That's normal. Hypertension is when somebody's blood pressure goes up and stays up. And as far as pediatrics and the specific numbers that would qualify a child as having hypertension, that depends on a couple of factors, including the child's age and their height, for example. But hypertension is something that is caused by a lot of things. There's certainly familial causes that we see running in families, but certainly there is an increase in hypertension, I think, related to lifestyle factors as well. And the lifestyle factors that are contributing to the rise in pediatric hypertension are the same lifestyle factors that are causing a rise in pediatric obesity, which I'm sure is not enough physical activity and poor diets, diets that have a lot of processed foods or foods that are high in sodium or salt. Certainly there's an association with lots of screen time, too much sugary beverages, all of those things.
So how is it treated in children?
Yeah, so for the first 3 to 6 months, we try what we call lifestyle modification, where we really dive in deep on managing those risk factors I just discussed. So making sure that we're getting enough physical activity, that we're cleaning up our diet. We often refer to dietitians, and certainly even as the physician, we talk a lot about diet as well. We're trying to decrease our screen time, decrease our sugary beverages. Important to prioritize good sleep as well. And also important to make sure you're getting regular checkups with the pediatricians, because they'll be our front line of screening people's blood pressure. But if the 3 to 6 months of lifestyle modification doesn't work, and sometimes it doesn't, we focus on medications, which there are a lot of good medications that we treat pediatric hypertension with that are safe and easy to use for families.
I imagine at some point you might end up treating a family in a way just because you're talking about a child using too much screen time or not getting the right diet. Right. It could be a trend that you see amongst family members. As a parent, you're always looking in the mirror. Your child is a reflection of you at a certain point.
Most definitely, and that's stuff that we try to address in the room at our clinic visits, because obviously it's easier said than done to say, oh, we should eat better and exercise more, but where the practice comes from is meeting families where they are on a personal basis and trying to identify the barriers as to why we're not getting enough physical activity, why are we not eating very healthy, and that usually involves across the entire family, which in some ways makes it easy, in some ways makes it harder. You know, it's easy because it's certainly easier to change these things if you have a whole family on board to do
Yes.
so. But as you said, it can sometimes make it more difficult because then we're asking parents to look in the mirror, as you said, and see what they can be doing better themselves.
Yeah, you know what they say, when mom is on a diet, the whole house is on a diet.
Yep.
You guys know, I've probably seen that. Okay, so Dr. Clary is here, and she is a cardiologist with IU Health. And we talked earlier about the family history aspect and knowing that these risk factors are identified. How can that work to help when you are assessing the child as well as the entire family?
Right, so I get patients referred into my clinic for various reasons. Sometimes they're coming from their primary care doctor after they've been identified as having elevated cholesterol. My practice really specializes in inherited cholesterol disorders or complex cholesterol disorders, so that's why I'm getting patients referred in. Many times these patients have known about this their entire life and been told it just runs in the family. I think what we do a really good job of in our clinic with the help of Ben and some of our other cardiovascular genetic counselors is to change that family history into a real diagnosis. And giving a patient a diagnosis rather than just saying something runs in their family can really be empowering for them. You know, we talk about how important it is to modify their lifestyle, right? Eat healthy, exercise, practice mindfulness.
Yes.
All of those things are so important to heart health, but truly understanding why, the why that it all started from, the high cholesterol, can be really important and empowering too. Once we get those patients identified and help with giving them a true diagnosis, is what I like to say, we've identified not just the patient, but oftentimes the family through the cascade genetic testing that we're able to offer. And then we connect with our pediatric colleagues, we connect with colleagues across the state to get these patients managed and to take care of them where they are.
Awesome. As parents, what should we look out for in ourselves as well as our partners when it comes to being able to also look at our child's health?
Well, I think you said it earlier, we all need to look in the mirror. As parents, you know, we need to care for ourselves. I can't be a good parent to my kids unless I'm taking care of myself. And oftentimes that's modeling the way, right? So that's making sure that, you know, as parents, we're doing our best to eat a healthy diet, show our kids that exercise is normal and fun and is part of life, you know, and make all those good choices in our lifestyles. It's also, you know, looking at our partners and saying, are you okay? You know, monitoring stress, trying to manage all these additional kind of compounding risk factors that we all have in our lives, but also recognizing, you know, typically if my partner was able to, you know, climb 2 flights of stairs without any symptoms, but now they're having trouble, calling that out, recognizing it and saying, you know, are you okay? Do we need to get you checked out by your doctor? Or do we need to take you to the emergency room? As parents, as partners, we have that responsibility to care for each other.
Absolutely. We're all responsible for each other. I find it very interesting that a common theme amongst what all of you all said is looking at the entire family and then also starting with treating this with diet, exercise, and lifestyle, starting there, that could be a real change, a really big impact on heart health and the heart health of our children. I think that's really interesting. I mean, I know it gets way more complicated and deeper than that, but for that to be the starting point, those are things that we can be in control of as parents, which is really, really cool. Any other advice that you all want to lend to families out there?
Well, Felicia, can I say one thing? You know, we 100% want to focus on lifestyle, but oftentimes we need more, and that's okay. It's okay for kids. It's okay for young adults. It's okay for everyone to start on medications if they need to. Sometimes that's what's needed. Oftentimes that's what's needed, and sometimes that's more than one medication. And if that's what you need to control your risk factors, that's what you need to take care of yourself. And so although again, you heard it from all of us, lifestyle is so important, but sometimes it's not enough. And when it's not enough, that's okay.
I appreciate you saying that because as we all know with parents, being parents, you feel like maybe you failed or something didn't go right when you get a diagnosis that isn't what you hoped it was. So I actually really appreciate you saying that.
And we see that in our clinic, right? So I'll get young adults or even older adults referred to me that, have been chastised by their probably friends, family, certainly by their physicians that, are you really taking your medicine? Are you really
dieting?
exercising? You must not be, because your numbers still look bad. And we're able to give them that diagnosis, that genetic diagnosis. And it's almost a relief for those patients.
Yes, which can be freeing and empowering.
It's not my fault, right? This is how I'm made. And then that kind of relief, that knowledge that they were really doing everything they could, is empowering for them then to own their condition and start on medication. And finally, after so many years, actually get their risk factors controlled.
Yeah.
And I would second that for pediatrics. There are a lot of cases in which our pediatric patients do need medication for a couple of reasons. One, lifestyle modifications are difficult, which I'll touch on, but also there are inherited things that really are not going to get better until you start medication. So it doesn't count as a failure if a pediatrics patient needs to be on medication. I totally agree with that. I will say also, though, that if families are struggling with lifestyle modifications, like, please do not be discouraged. I think that as a family, you should make small, achievable goals that the whole family can meet, because it only takes small changes to start the process to reduce your cardiovascular risk.
Certainly, certainly. Okay. Thank you all for sharing. I certainly appreciate it. I think we all appreciate it. Everyone at the end of the day is just trying to really do the best they can as parents, but to be armed with information and be empowered with that information, I think is a really important part of the process. So thank you for sharing. And all of their parents too, so they get it, okay? They get it. They're medical professionals, but parents as well. Thank you for being here. A lot of good info. We have more info on IU Health and Riley Children's Health. You can head to WTHR.com/Parent Squad. And still ahead, we're going to talk about being your own best advocate. We actually talked to one mom who stepped up. She spoke out at the Indiana State House, and she is working to make a difference there.